What's your connection with Courage Ride and sarcoma research?
Sure. So I joined the Courage Ride family in 2016 when I also joined as a faculty member here at University of Iowa. And since then, I have been pursuing sarcoma research and designing clinical trials, doing translational studies with our sarcoma group, and supporting the Courage Ride, and in turn, that ride funds have been helping us pursue our research goals.
Yeah, I've been really struck by how, one, how much of a community is, and then how much of like a system it is of like, how everything benefits everything else in this world.
Absolutely. All the funds that are raised every year, they have been helping us as researchers to advance the sarcoma treatment, to develop new strategies of treating this resistant cancer. And it's been great working with everyone in the Courage Ride family to help raise funds.
Now, in talking to some other folks, it was enlightening to me both like how important the research is, because there isn't, it's because it's rarity that there isn't like these these research going on for years and years, very broad, that it's this very rare thing, and a lot of it happens at the University of Iowa.
That's right. Yeah, sarcomas are very resistant to treatment, and so we really are working hard to find newer treatment strategies. A lot of basic science researchers and clinical researchers have put in a lot of effort and their career into developing some newer treatments for this cancer.
Yeah, I can really, in talking to people, sense you obviously have to have skills and knowledge base to set up studies and stuff, but there's just a real passion behind what you guys do.
Oh, definitely. I think we have a great collaboration here. We all talk to each other. We have our scheduled research meetings and tumor boards, and it's really great to work with everyone here in the sarcoma research team.
So let me ask you this: where would sarcoma research be without the Courage Ride, if it didn't exist, never existed?
Yeah, I just can't imagine. It would be really hard because a lot of funding is needed for finding newer treatments for this rare cancer type. So unlike other cancers, which have a lot of funding mechanism, a lot of foundation support, and support from the NCI, the National Cancer Institute, sarcoma, on the other hand, seems to be more forgotten cancer. And I think raising awareness through our Courage Ride also helps, just letting people know in the community as to what this cancer is, how to identify it, when to first seek an opinion, and and that helps raise awareness. And then through this ride, we are also then helping to generate funds, which all go towards sarcoma research.
Yeah, and you mentioned right away joining the family. It does seem like there's a family, from the researchers to the doctors to the people that are helping to raise funds to the survivors.
Oh yes. So yeah, I think patients who've helped, who've gone through a lot of treatment, are part of this big family, and they have been coming out to support sarcoma research every year, biking along with us and generating awareness and helping raise funds at the same time. So it's a great community support and patient support that we have that really goes toward making this successful.
And does that make a difference for you as a researcher? I imagine you could get stuck. It'd be very easy to get stuck in statistics and how we're going to go about doing this. I imagine it's very helpful to have connection to survivors.
Absolutely. I mean, it's nice to see them in clinic, but then to see them outside the clinic, and when they are riding together and meeting in a different environment, I think it's a whole new different feeling that that really makes you feel like it's truly a family, and we are all in this together, and we are all going towards the goal of finding cure for this cancer someday.
Yeah, it seems really unique that it's like we said, like there aren't big funding mechanisms. There aren't these huge organizations that have existed for years and years and years. That when someone participates in the Courage Ride or contributes financially, that they're kind of wrapped into this small, tight-knit community.
Yes, yes. So sarcoma, it has there's several different types and subtypes of sarcoma, and so each sarcoma behavior is very different from each other. And so I think even within the big family, there are smaller families of patients with this particular type of cancer that have had different outcomes. And so it's just nice to kind of see them all together, and raise funds together for each of these different subtypes of sarcoma. And I think that it's what unique about sarcoma. It's not just one cancer. It's actually several cancers combined.
Yeah. So if there are people that are doing the virtual ride, or maybe they've already done it or doing it, or they're watching this right now, what would you want to say to the people that are supporting the cause?
Well, I would say, first of all, thank you to each and everyone who's coming out and supporting us and supporting this ride, helping raise awareness about sarcoma, and also to help generate funds. I can assure that each and every dollar counts, and it helps us all as researchers to work together to develop new innovative trial designs and medications, which will all go towards helping each and everyone who's affected by this cancer. So thank you, everyone. That's what I would say.
Yeah. So last question, are you a cyclist?
I am absolutely. Yeah. I've been riding every year since I joined.
Cool. And have you done it yet, or are you planning on doing it for this kind of more individualized virtual version of it?
Yes, so we have actually formed a nice group of friends, and we are trying to do a little by little every day. I think majority of it will happen on this weekend.
Yeah.
I really hope to keep riding.
Yeah. Well, Varun, thanks so much for joining us. It's insightful to hear your perspective on how it kind of all comes together.
Absolutely, Jeff. No, thank you. Thanks for helping us.
You did it. We did it.
We did it.
Easy.